We are the best. Yes, exactly. We are the best. Okay. I hope you guys are doing great. I hope life is beautiful. And yes, give your best shot, guys. Give your best shot. I really want you guys to do well in your exams. And that's what. Okay, okay. Let's just, okay. Yeah, I think it's coming. Is my voice coming to everyone? Great. Good morning, everyone. A beautiful day today. My name is Dr. Anand. Please put a thumbs up if my voice coming to everyone. Yes or yes, yes. Please let me know in the comment section. Okay, that's great. Perfect. Good morning, everyone. Yes, now I know my voice is coming. Everything is coming. Let's start off this class. And today's topic of choice: rapid revision. Lot of images, videos, this, that, and everything. Perfect. Yes. Good morning, Latasha. We have Kuldeep. We have Bhagana, Meera. We have Parvesh. Great. चलो जी. Quick revisions, quick questions, question answer खेलते हैं. Very importantly, knowledge plays a very important role. I want you guys to motivate yourself as much as possible. Success is definitely ours. You need to have a positive attitude. Goal is चिड़िया की आँख तो चिड़िया की आँख. Performance is top level. Support is always there. An idea of how to study and make a wonderful timetable and revise. That's it. A neonate born at 34 weeks of gestation, weighing 1.9 kg. Is stable and started kangaroo mother care. After 6 hours, the auxiliary temperature is 36.1 degrees Celsius. What is the next best step? So this patient has a temperature of 36.1 degrees Celsius. ABCD, what is the best answer? So the normal temperature of newborn is 36.5 to 37.5 degrees Celsius. So we all know 36 to 36.5, very importantly, that is mild hypothermia. That is known as mild hypothermia. And mild hypothermia, it is also known as cold stress. Number one, yes, very importantly, start empirical antibiotics. So what do you think, guys? Will you start directly antibiotic? No, antibiotic we start in a case of neonatal sepsis. Antibiotic we are starting in a case of neonatal sepsis. Number one. Number two, fast rewarming until the temperature reaches 37 degrees Celsius. This we do in severe hypothermia. In a case of severe hypothermia, हम जल्दी से बच्चे को गर्म करने की कोशिश करते हैं. In a case of severe hypothermia, we basically do the fast rewarming. Number one. Number two, give IV dextrose infusion. IV dextrose infusion is for symptomatic hypoglycemia. So the best answer for this question, very importantly, is option number B, that continue kangaroo mother care and recheck the temperature in 30 minutes. B is the best answer. Yes, a 2-year-old boy, 15 kg, was brought to the hospital with a history of loose stools. 2-year-old boy with loose stools. He is afebrile and there is no blood in stool, so dysentery is not there. The baby is lethargic. On examination, the eyes are sunken, and during the skin pinch test, the skin retraction took more than 2 seconds. On offering water, the child does not show eagerness to drink. Now this is the main point. The child does not show eagerness to drink. What are we talking about? We are talking about severe dehydration. And what is the fluid of choice in severe dehydration? Ringer lactate with 5% dextrose. It is given at the rate of 100 ml per kg. It is given at the rate of 100 ml per kg, and this 100 ml per kg is divided into 30 and 70. 30 ml per kg will go over 1 hour. 30 ml per kg will go over 1 hour. So 30 ml per kg will go over 1 hour. So 1 kg baby 30 ml. So 15 kg baby, 15 into 30 is 450 ml. So definitely 450 ml you have to do. So that's the best answer for this question, is nothing but 450 ml. Very importantly, yes, 450 ml will be given in half an hour, and next rest of the 70 ml per kg will be given in 2.5 hours. Exactly, very good. C, yes, Neeraj is right. Neeraj Kumar, yeah, Kumawat, very good. Yes, C is the best answer. Okay, so yeah, exactly. And yeah, the whole treatment we have it over here. C is the best answer. 30 ml per kg in half an hour, and very importantly 70 ml per kg in 2.5 hours, because the child is more than 1 year old. That's why. Okay, which of the following milestone is expected to be seen in a 3-year-old boy? 3-year-old baby, which milestone are you expecting? Yes, very good, beautiful point. Very importantly, a baby knows his full name, age and sex. A baby knows his full name, age and sex. Yes, a baby knows his full name, age and sex by 3 years, and he can go to toilet alone by 4 years. Yes, he can go to toilet alone by 4 years. Telling poems and stories, roughly 3 to 4-year-old baby will do. A baby can come downstairs on alternate feet. He can come downstairs by 4 years, and even 3-step command also a baby can understand basically by 3 to 4 years. But the best answer for this question, very importantly, a baby knows his full name, age and sex by 3 years. That you should know. Very good. The 2-month-old infant is brought to the clinic for a developmental checkup. Which reflex should the clinician expect to see at this age of development? So 2 महीने के बच्चे में कौन सा नियोनेटल रिफ्लेक्स आप एक्सपेक्ट करते हैं? सिमेट्रिक टोनिक नेक रिफ्लेक्स, पैराशूट रिफ्लेक्स एंड लैंडौ रिफ्लेक्स. These are the 3 reflex which comes later in life. They are not present at birth, and even parachute reflex roughly comes by 10 months of life, and Landau and STNR, they comes by 4 to 6 months of life. So 2 months of life in general, we definitely expect a Muru reflex. Once you suspend the baby will have a opening of hands, abduction and adduction. So very, very important, number 1. Number 2, very importantly, a 2 days old neonate came with complaints of distress, frothing of secretions, dribbling of saliva, and mother having history of polyhydramnios. What do you think, guys? Drooling of saliva, frothing of secretions, and mother having history of polyhydramnios. So X-ray is not important. Like, what do you think? If the mother is a case of polyhydramnios, the baby can land up into a tracheoesophageal fistula. TEF is the best answer for this question. Okay, yes, and intentionally I did not show you the X-ray, because without X-ray also you should be able to understand this. Why it is not a hyaline membrane disease? Hyaline membrane disease, it is the most commonest cause of distress in a preterm baby. Okay, and hyaline membrane disease only, it is also known as respiratory distress syndrome. And transient tachypnea of newborn, it should be a term newborn baby who is born with LSCS. Term newborn baby born with LSCS and with tachypnea, then I would have thought of transient tachypnea of newborn. A baby is noted to have a diffuse ecchymotic swelling on the scalp immediately after birth following a prolonged vaginal delivery. So prolonged vaginal delivery, which swelling are we talking about? Yes, we are talking about caput succedaneum. We are talking about caput succedaneum. So it does not, which of the following is correct about caput succedaneum? Very importantly, yeah. So yeah, exactly. So a prolonged vaginal delivery with vacuum extractions, so ecchymotic swelling on the scalp immediately afterwards followed by a prolonged vaginal delivery. Very importantly, prolonged vaginal delivery. And so what are we talking over here? So 2 options can happen, very importantly. Either you can have a caput succedaneum or you can have a cephal hematoma. Now basically, this is not a caput succedaneum, this more touching because of the vacuum extraction, so this definitely, very importantly, is it caput succedaneum or cephal hematoma? So very importantly, yes, it is a what you call caput succedaneum. And it is which of the following is correct about caput succedaneum? So caput succedaneum, very importantly, it is maximum size at birth. It takes 12 to 6 weeks to resolve. That is the wrong part, very importantly, because caput succedaneum, very importantly, takes around 3 days to resolve. Very importantly, caput succedaneum, does it cause jaundice? So caput succedaneum, very importantly, does not cause jaundice. Cephal hematoma causes jaundice. It has a maximum, very importantly, it has maximum size at birth. No, this is the correct point about caput succedaneum. It is the maximum size at birth. जो cephal hematoma होता है वो 24 घंटे के बाद और बड़ा नजर आता है. cephal hematoma 24 घंटे के बाद पूरा एक पक्के वाला हो जाएगा, लेकिन caput जो birth पे हुआ है, it is maximum size at birth. It does not cross the suture line or does not cross the midline. So that is a wrong statement, because caput succedaneum is a diffuse swelling. So prolonged vaginal delivery with vacuum, this extraction, the answer is caput succedaneum. Identify the SMR staging. Yes, exactly. We will very beautifully clear the exam. Don't worry. Identify the SMR staging. So very importantly, what do you think? In which stage of the SMR you see generalized breast development? So in which stage of SMR you see generalized breast development? So very importantly, generalized breast development happens in stage 3, and nipple and areola separately seen. Nipple and areola separately seen, that you see in stage 4. So this is a generalized breast development. Identify the SMR staging. It is stage 3, because generalized breast development happens in stage 3. What is the first visible sign of puberty and hallmark of SMR2 in boys? What is the first visible sign of puberty? We all know the mnemonic was the parents meeting. T for testicular development, P for pubic development, penis development, and M for men's facial hair. So definitely testicular development, but please remember testicular development at 9.5 years of life. Testicular development is the first thing and roughly comes by 9.5 years of life. Remember that. So A becomes the best answer for this question. What is the correct order for events of puberty in a girl? The correct order for events of puberty in the girl, very importantly, we all know the parents meeting again. So it is thelarche, pubarche, but but main thing, it is the parents, meeting. So the parents general meeting, remember that, the parents general meeting, remember that. So it is thelarche, pubarche, G for growth spurt, and menarche. The parents general meeting, general for growth spurt, thelarche, pubarche, growth spurt, and menarche, remember that. Okay, gynecomastia in a neonate is seen due to what? Yes, we have done that. Gynecomastia in a neonate, basically a neonate with the breast development, male neonate with breast development is gynecomastia, and it is because of maternal estrogen levels. Exactly, it is because of maternal estrogen levels. Very good. A newborn presents with yellowing of skin on the face and sclera at 48 hours of age. Bilirubin is elevated but within the range expected. Jaundice gradually progressed to the trunk and extremities. Which of the following is the most appropriate management for this patient? This also one student has asked me this question. Okay, so 2 दिन का बच्चा है, पीलिया लग रहा है, जो थोड़ा सा बढ़ भी रहा है मान लिया, तो what will you do? ठीक है, immediate exchange transfusion, मतलब पूरा खून उसका निकाल के नया खून डाल दोगे, उसको बोलते हैं exchange transfusion. Removing the whole blood of the baby and putting a new blood to the baby is known as exchange transfusion. That we do in very, very sick babies, not in this healthy baby like that. Administration of IVIG. IVIG is used in Kawasaki disease. IVIG is not used over here. Initiate phototherapy and observation and reassurance. So very importantly, remember at 48 hours of life, physiological jaundice जो थोड़ा सा बढ़ेगा और फिर बाद में ठीक हो जाएगा. So if I have to choose phototherapy and observation, I will undoubtedly choose observation, because if observation, the bilirubin still increasing, then I will go for phototherapy. But if both options comes, I am going to choose observation and reassurance. You are the hero of your story, you are the king of your life, you can do anything. You just need to have a positive mindset and everything will make sense. Make sure you have done a lot of grant tests and computer based teaching, CBT and everything, all the revisions you have done. And it's okay if you have not done also, it's okay, keep on revising. जितना भी जो भी जैसा भी समय है, आप उसको अच्छे से खत्म करें. Then we have a baby like this. Okay, what do you think this baby has? So if you look at this baby very carefully, he's having an infantile spasm. This is the classical case, very importantly we have, of the infantile spasm. बच्चा ऐसे spasm मार रहा है. Can we appreciate this point? हल्का हल्का like that the baby is having spasm. So infantile spasm very importantly can be seen in a case of West syndrome also, and in a case of tuberous sclerosis also. Infantile spasm can be seen in a case of West syndrome also and tuberous sclerosis also. In the West syndrome, the drug of choice for infantile spasm is adrenocorticotropic hormone, and the drug of choice in tuberous sclerosis is vigabatrin. Drug of choice in tuberous sclerosis is vigabatrin. ये बच्चा जो ऐसे कर रहा है, I'll repeat again very importantly, this baby is suddenly doing like this and quiet and suddenly doing like this. This is infantile spasms, and it is seen in West syndrome also. There the drug of choice is adrenocorticotropic hormone, and it is also seen very importantly in a case of what you called this one, tuberous sclerosis, and there the drug of choice very importantly, that is nothing but vigabatrin, that you should know. Next important point we have it over here is, yes, this is again a very important question. Very good, everyone is answering so amazingly, perfect, very good, that's right. So okay, the next one, a 12-month-old child is brought to the routine well baby visit. Which of the following findings should normally be present at birth? Very simple, very easy. 1 साल के बच्चे में क्या एक्सपेक्ट करते हैं आप? So in a case of 1-year-old baby, what are you expecting? Number 1, tripling of birth weight. Okay, so very importantly, weight doubles by how many months? Yes, exactly, my dear Dimple. So weight doubles by 5 months and triples by 1 year. Weight doubles by 5 months and triples by 1 year. So yes, tripling of the birth weight is expected. Building a tower of 6 blocks, that is not expected, because a baby can make a tower of 2 cubes by 15 months and tower of 3 cubes by 18 months and tower of 6 cubes by 2 years. So this is a 1-year-old baby. Ability to stand without support, yeah, that is done. Sitting with support comes by 6 months, sitting without support 8 months, standing with support comes by 9 months, standing without support comes by 1 year, which is expected from him. Mature pincer grasp, definitely holding something with thumb and index finger like that, that is known as mature pincer grasp, comes by 1 year. I agree with him. And a baby can say wave bye bye. So by 9-month-old baby can say baba or bye bye. 8 to 10 words vocabulary comes by 18 months. 8 to 10 words vocabulary comes by 18 months. So very importantly, the best answer for this question is 1346. Weight triples by 1 year. stand without support by 1 year, mature pincel grass 1 year, and bye bye by 1 year. Okay, this is a very important, good question. A primary gravida delivered a baby at 34 weeks of gestation. The baby was cyanosed and grunting with the RR of 72. Which of the following score can be used to assess the condition? So, for a preterm baby, the name of the scoring system to assess the severity of distress in a preterm baby is Silverman-Anderson score, and for term baby we use something known as Downey's score. For term baby we use Downey's score. 20-year-old baby came with complaints of not passing urine. What is the next best step in the management? So baby should pass stool within roughly around 48 hours and urine within 24 to 30 hours. If you don't remember also, 1 से 2 दिन के अंदर बच्चा potty और सूसू करना चाहिए. A baby should pass urine and stool within 24 to 48 hours of life. That is why in this case wait and watch becomes my best answer. Which of the following statement is not true regarding the tape shown below? So the tape shown below, we all know that is Shake tape. It is used in children with 6 months to 5 years. Yes, that is very true. Shake tape is used for 6 months to 5 years. Reading in the red zone is considered as severe chronic malnutrition. This is the wrong answer. Red zone is severe acute malnutrition, not severe chronic malnutrition. This is not true actually. Yellow zone considered as moderate acute malnutrition. Yes, and the green zone is normal. That is yes. Okay. The device shown in the image can be used in children's to which year of life? So very importantly, to measure the length of the baby, the instrument is infantometer, and infantometer, very importantly, it is used till 2 years of life. Okay. A male neonate of diabetic mother presents, very importantly, yes. So life is beautiful. Yes, exactly. A male neonate of a diabetic mother presents with progressively deepening cyanosis and tachypnea since birth. This baby has cyanosis and tachypnea since birth. On auscultation, you have a murmur, and X-ray is given below. So the highlighter number 1, diabetic. The most common congenital heart disease in infant of diabetic mother is a VSD, and most specific is TGA. And TGA is a cyanotic congenital heart disease. VSD is a acyanotic congenital heart disease, and this is a ande pe dhaga. This is egg on side appearance. So very importantly, TGA is the best answer. If the mother has taken lithium during pregnancy, yes, the baby can land up into Epstein anomaly. And tetralogy of Fallot, very importantly, will have a boot shaped heart, and supracardiac TAPVC will have a figure of 8 appearance. What is high risk among the following? इन सब बच्चों में से high risk कौन सा है, कौन से वाले को भर्ती करें? The normal weight of a newborn baby is 2.5 to 4 kg, so anyone less than 2.5 is a high risk. And we all know that, if you remember, we have done that weight for age graph, and we have the 10th percentile and 90th percentile. So weight for age between 10th and 90th percentile is appropriate for gestational age, if you remember. So naturally, yes, very importantly, weight for age less than 10 percentile is high risk. SGA, LGA, so all of the above is definitely high risk bacha. Okay, number 1. Number 2, very importantly, what is high risk among the following? Is single parent is high risk, single mother also is high risk, single parent basically it is high risk, twin pregnancy is high risk, maternal age less than 60 and more than 40 is high risk, and mother having any problem, it is a high risk baby. Remember that. Okay. And what is high risk among the following? इसमें कौन सा है? Breastfeeding and artificial feeding? Yes, very good. Of course, artificial feeding is high risk. And when do you celebrate breastfeeding week? You celebrate breastfeeding week in the first week of August. Very, very important. On a routine ultrasound, multiple fractures were present in the scan. What is the next best step? Simple, straightforward. A newborn baby with multiple fractures, with blue sclera, with deafness. Very importantly, the answer is osteogenesis imperfecta, which is also known as brittle bone disease. Remember that. Okay, very good. Which of the following is a autosomal recessive inheritance? We have done that. A mother while kissing her child found her child's skin salty tasting. So very importantly, yes, the answer is cystic fibrosis, and it is autosomal recessive inheritance. And the autosomal dominant inheritance, we had done that mnemonic: M for Marfan syndrome, A for achondroplasia, T for Treacher-Collins syndrome. Remember that. that. Okay, that you should know. Very good. That's perfect one. This one is done. Next important point, 6-year-old child with pain abdomen with rashes over the lower limb. Pain abdomen, rashes over only in the lower limb, only the lower limb, and in the kidneys you have hematuria. So straightforward, it is a Hinong-Schonlin purpura, palpable purpura specifically in the lower limbs, and IgA deposition in the kidneys will cause hematuria. In the GIT it will cause pain abdomen, and in the skin it will cause rashes. Why it is not nephrotic syndrome? Nephrotic syndrome will have a NSRCA, massive proteinuria, hypoalbuminemia, and hyperlipidemia. Why it is not SLE? SLE will have a butterfly malar rash, or butterfly rash will have. During a 1-minute APGAR score, the baby had a 110 beats per minute. So very importantly, heart rate 0, 1 and 2. So no heart rate 0 score, less than 100 and more than 100. So definitely 110 beats, I'll give 2 score. Lusty cry means obviously 2 score I want to give. And acrocyanosis, so yes, we all know that if the baby is totally blue, पूरा नीला बच्चा पैदा हुआ है, तो 0 score. If the patient has acrocyanosis, then that is 1 score. And minimal flexion to stimulation, no flexion to stimulation, minimal flexion to stimulation, and good flexion to stimulation, again 1 number. So straightforward, yes, the best answer for this question definitely is 6. So the best answer for this question is definitely 6. If 6 कैसे किया था हमने? So 2, 2, 4, 1, 5 और 1, 6. So 6 becomes the best answer for this question. Please remember that. Okay. Last question, a 1-year-old child came with complaints of pain abdomen, palpable mass, and X-ray showing this. Forget about X-ray, I'll not show you the X-ray. Pain abdomen, palpable mass, pain abdomen, palpable mass. What do you think? Many of you, very importantly, हाँ जी, ऐसा कुछ होता नहीं अभिषेक कि फोटोथेरेपी कितने बिलिरुबिन पे स्टार्ट करते हैं, ऐसा नहीं होता. दिन के हिसाब से, टर्म प्री टर्म, रिस्क फैक्टर के हिसाब से होता है. अगर फिर भी एक याद करें तो 12 से नीचे तो हम कभी स्टार्ट नहीं करते, 12 से नीचे हम कभी स्टार्ट नहीं करते. सो वेरी इंपॉर्टेंटली द बेस्ट answer, okay, many are saying is CHPS. No, very importantly is, do you think it is CHPS? Congenital hypertrophic pyloric stenosis is seen in 2 to 6 weeks baby. 1 से 2 महीने का बच्चा, ये 1 साल का बच्चा है, 1 साल का बच्चा है, और एक्सरे में ये था. Where do you see claw sign? Very importantly, claw sign. So claw sign you see in a case of intersusception. This is the case of intersusception. This is not congenital hypertrophic pyloric stenosis because age 1 साल के बच्चे में नहीं होगा, वो तो न्यूबॉर्न बच्चा होगा. vomiting and with vomiting and metabolic acidosis and all that. I know olive shaped mass वहाँ मिलेगा, but 1 साल का बच्चा, pain abdomen, palpable mass, and red current jelly stool we are talking about, and we are talking about intersusception. That finishes this class. Thank you so much everyone. Life is beautiful, life is amazing. May God give you everything in life. Motivate yourself as much as possible, and that's it. Okay, let me ask you randomly. If I ask you, I want to show you one video. Let's see if you can answer this. Can we appreciate this video right now? What is happening in this video? ये क्या किया अभी? If I'm touching the sole of the foot, look at the toes. Toes को क्या हो गया? Extensor plantar response, fanning of the toes, extensor plantar response. If I touch the toes like that is extensor plantar response, very importantly. And you see this is the case of upper motor neuron lesion. This is the case of upper motor neuron lesion. Remember that this is Babinski extensor plantar response positive. Remember that. Okay, if let me show you one more video. Okay, one more video. Okay, yes, this is the one more video. We have it over here. A newborn baby, I was pressing the nipple of the newborn baby, and there is a milk discharge. This one, a newborn baby having a milk discharge from the nipple. What are we talking about? This is galactoria, and this is because of the maternal estrogens. माँ के estrogen की वजह से ऐसा हुआ है करके. So remember that. Okay, that you should know. Last point, one more thing also. Let's see if you can answer this one. So we have a child, this one, let me just show you the photo A, this one. So what do you think, guys? A male patient with a webbed neck, what are we talking about? We're talking about Noonan syndrome, male patient with a webbed neck. And the most common congenital heart disease in Noonan syndrome, very importantly, is nothing but pulmonary stenosis. I have a newborn baby. If I touch the newborn baby, this one, if I put a finger on the palm, he grasp it, known as very classical, known as palmar grasp. And also, can we appreciate बच्चा थोड़ा नीला भी लग रहा है? So acrocyanosis is also there. So palmar grasp with acrocyanosis, that is happening over here. Next one, what is the game I'm playing with the baby? This one, look at this baby. So what are we talking here? Oscar class चल रही है, तमीज में रह ले, मार खा लेगा. So what is this? This game, very importantly, it is known as peekaboo. This game, very importantly, it is known as peekaboo. So when can a baby play peekaboo? A baby can play peekaboo by 10 months. A baby can play peekaboo by 10 months. So very importantly, I'll show you one more picture. Look at the camera. Look at the camera. So in the camera, we have a baby like this. So if I ask you a simple question, when can a baby knows his full name, age, and sex? So baby knows his full name, age, and sex by 3 years, and he can go to toilet alone by 4 years. He can go to toilet alone by 4 years. There's A for B for C for अच्छा बाइक फ्लाइंग किस कैसे करता है? वो फ्लाइंग किस कैसे करता है? फ्लाइंग किस करो.
देखो फ्लाइंग किसी को.
वेरी गुड. चलो जाओ, ठीक है. So this is done, and we have the last video now. I'll show you the last video. This is the last video. Let's see if you can identify this video. So this one. So very importantly, if you look at this camera over here, again this baby is holding something, but what do you call this grass? This one. If he is holding something, what do you call this grass? This one. एक हाथ से पकड़ना. What do you think? What are we talking over here? So very importantly, we are talking over here is unidextrous approach. We're talking over here is unidextrous approach. A baby holds something with one hand, that is comes by 6 months. Holding something with both the hands is bidextrous approach. Holding something with one hand, that is a unidextrous approach. और एक चीज़ और भी करी इसने. और क्या करी? जो भी दिया मुंह में डालिए. This one. So what do you call this? He's putting everything in the mouth. What do you call this? This is known as mouthing. This is known as mouthing. So thank you so much everyone. That was a beautiful day. That was a quick revision of pediatric important questions. Best of luck for the exam, and remember guys, you have got this. You will definitely clear. There is no doubt about it. Most importantly, last minute advice, that don't read anything new. Revise the old stuff. Number 1. Number 2, very importantly, before opening the paper, 5 deep inspiration. 1 2 3 4 5 inhale, मन में बोलना है, and then 1 2 3 4 hold the breath, and 1 2 3 4 5 6 exhale. Do that 5 times, and then open your eyes, and then open the paper, and you will perform the best. This is a small mantra which you will always be helpful for you in your life. In any conditions, do like that, and you will बेड़ा पार हो जाएगा. You will clear. So thank you so much everyone. Life is beautiful, and जाने से पहले याद रखिएगा, हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन. हो मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन. So thank you so much everyone. That was all about Dr. Anand, and that's it. Please